about negative affect and then how cannabis can potentially impact negative affect, and you draw physical activity studies on that effect. So I am a postdoc at CU Boulder, at CUChange, and I will disclose that the analysis I'm presenting today are secondary to a fully powered NIH-funded study, so just keep that in mind as we kind of go through this. So first piece of the puzzle, negative affect can be broadly just defined as an experience of negative emotions. There's a lot of pieces within negative affect. There's a lot that goes into it. Some of the more common ones that you may have heard of are anxiety, depression, stress. There's a lot of different ways to measure negative affect as well. One clinical measure out there is the GAT-7, the Generalized Anxiety Disorder. And on this measure, anything that is a score of 5 or greater is going to be considered mild or greater anxiety. Keep that in mind later when we're describing our patient and participant population. Another measure of negative affect is the DAS-21, depression, anxiety, and stress combined. And what's really nice about this scale right here is not only does it describe total affective or negative affecting state, but you can also have subscores for depression, anxiety, and stress. And I'm not going to go into those today. We're just going to talk about overall negative affect. Cannabis, again, the reason why we're all here, we probably know a lot about it. It's a quickly expanding market, not just in the US, but within Canada and other nations as well. And one of the common uses, at least medicinally, for cannabis is to help mitigate symptoms of negative affect. A lot of medical patients are saying that they're utilizing for anxiety, depression, and there's some other ones that they're just not as heavily represented. We know that those active components that we're primarily focused on are THC and CBD, and those are going to come into play here in a little bit when we're describing the cannabinoid chemovar concentrations, OQ products that have participants that can be utilized. And generally, it's kind of accepted. There's a lot more research that still needs to be done, but in kind of general kind of consensus is that cannabis can help reduce symptoms of negative affect or help reduce anxiety, specifically cannabis products that are higher within CBD. The third component here, physical activity. There's a lot of benefits to engaging in regular exercise and physical activity. The American College of Sports Medicine, ACSM, actually started the initiative back in 2007 known as Exercise is Medicine. And the goal of ACSM is to get people that are engaging in at least 150 minutes of physical activity every week. At that threshold, that's when we really start to see some positive benefits. Some of those benefits, disease prevention, you see reduced risk for cardiovascular disease, metabolic diseases, cancer. We see these individuals that are getting regular activity, having higher quality of life, reduced medical burden, and one of the kind of benefits of exercise as well is reducing negative affect. It can actually have a really positive impact on reducing the symptoms of anxiety. There are a lot of individuals out there in the world right now that are using cannabis intentionally with their physical activity or as part of their physically active lifestyle, and kind of want to explore the role of that. So how this relationship might impact those individuals that are using cannabis and also are physically active. One thing that's difficult with physical activity is it's very difficult to get a good subjective measure of how active someone is. We all like to think that we're kind of Iron Men in our own rights, right? We probably have a tendency to overestimate how much physical activity we're getting, how many steps we're getting a day. And one nice objective measure of physical activity is utilizing actigraphy or accelerometry. It can give us a really kind of finite amount of how much exercise those individuals are engaging in. So looking at this, we're going to use, for this study, an accelerometer. We're going to have you wear that on your wrist, and it's the duration in 2 weeks. What's really nice about these accelerometers, basically every time you move, it's going to count an event in the XYZ axis, and based on the number of events per minute, we can roughly estimate how physically active that person is being. So if we have events, in that 0 to 99 range, we're going to say that they're relatively sedentary. But if they're at a threshold above 1952, they're going to be at least engaging in moderate or vigorous physical activity. So if you are like my friend Kronk here, you might see how this is kind of all starting to come together. We're seeing a relationship between cannabis and physical activity and negative affect, and negative affect and cannabis. However, no one so far has looked at all three together and the impacts that they may have on each other, at least when it's pertaining to negative affect. So, the purpose of this analysis is to determine if physical activity status moderates the relationship of cannabis use on negative affect. Our hypothesis was that as we are seeing increasing levels of physical activity, that we're going to see an additive effect with those improvements in negative affect. So the more physically active you are, the more benefits you're going to get out of your cannabis use. And like I said before, this is secondary analysis. So, brief overview of the study design. The participants that we were recruiting had to have at least mild or greater anxiety by recording a score greater than or equal to 5 on that GAD-7. They had to also have at least one previous use of cannabis throughout their lives, and they had to also desire to utilize cannabis to cope with their symptoms of anxiety. So this was a anxious population that we're going to be looking at. It's not necessarily the average everyday individual, but individuals with anxiety. For negative affect, we were measuring that longitudinally and utilizing the DAS-21. We were measuring cannabis use in this kind of naturalistic active study via a TLFB, and then physical activity we were measuring via activity. The analysis that we're going to be going to as well was done utilizing generalized estimating equations, and that's largely because of the non-normal distribution of the physical activity data that we collected. So, just looking at the general kind of population that we were assessing, we had a total number of 178 individuals that we had all these measures on. You can see an average age about early to mid-30s. It's actually a primarily female study population, which is not something you see very often within the cannabis literature. And one thing I'll also disclose that seems to be relatively consistent, it is a predominantly white population. The area that we live in, and see Boulder is very, very white. It's also very, very physically active. And so that's very reflective of kind of the area where this study gets collected. Also, I'll mention that over this 4-week abdomen study, these individuals were utilizing their cannabis products approximately once every other day, so about 14 to 15 times over that 28-day period. We also assigned these individuals randomly to a different type of cannabis products, so either the CBD dominant, THC dominant, or product that had relatively equal amounts of THC and CBD in it. So when we're looking at these models and how the just general effects of cannabis use on negative affect, we're seeing in general, everyone is improving in their affect over time. So their levels of anxiety, stress, depression in general are getting better over time. But what you can see at the bottom there is we do have a significant three-way interaction between time, through, and our physical activity steps. But before we get to that, I just kind of want to show the group by time interaction as well. We can see that, again, everyone is generally improving over time, but there might be some indications there that the individuals utilizing CBD dominant products are experiencing just a little bit more pronounced effects than the THC or THC plus CBD groups. Right, getting into this three-way interaction, you can kind of see this all up here, and it might be a lot to kind of take in, and I'll go into each one of these groups individually, but we're kind of seeing that there is definitely an effect of physical activity here. It is moderating these responses to cannabis use and negative affects. So looking at the CBD group right here, we are seeing that regardless of physical activity status, everyone is generally improving the same over time. So regardless of whether you're highly physically active or you're sedentary, CBD products are helping these individuals improve the negative affect. However, when we get into the THC group like here, we're seeing that the less physically active you are, the greater benefits you're getting from the THC, which is kind of counterintuitive to what we originally thought. But the reason for that being, as you think previously, then the kind of intro that I was doing is exercise and negative affect do have a fairly tight relationship there. And because these individuals are less active, they might kind of have more room for improvement compared to those that are more physically active. And then what we're seeing in the THC plus CBD group is that only those that are at moderate or high physical activity levels are seeing improvement over time. Those that are not physically active are not seeing any improvement. So that is kind of where we're starting to see physical activity start to take a moderated role in this relationship of cannabis use and negative affects. So general conclusions, the answer is yes, physical activity status is going to be moderating that relationship between cannabis use and negative affects. We're seeing that across the board, CBD is having kind of the most consistent beneficial effects compared to THC or THC plus CBD products. We are still seeing effects in those groups, but they're just not as pronounced. Some future directions that, myself and other individuals should start to kind of explore is physical activity, cannabis use, negative affect. Those are all things that can vary over time. I could wake up tomorrow and just wake up on the wrong side of the bed. My anxiety, my stress, my depression, they kick you through the roof. So I think utilizing daily data to look at these relationships a little bit more would be really interesting to kind of explore going forward. And then also kind of the big question up here is, does cannabis actually change physical activity engagement in general? That's not something that's necessarily been explored yet. So if you're using cannabis more often, are you more or less likely to engage in physical activity? That's not necessarily an answer we have at this handy time. So that's all I have to say. I'd like to thank my co-collaborators, the entire CUChange Lab. It definitely takes a village to do this type of research. There's a lot of us. Aaron's, my guys, Dr. Bidwell and Dr. Brian, they're fantastic. That CUChange, we lost without them. So, we'll give them a shout out. Thank you all.